Good afternoon. I'm Katie Cardone, and I've been interning at Geisinger and working on the MyCode project, which aims to learn about genetic conditions at a population scale by linking health records with genetic data. MyCode returns results based on the American College of Medical Genetics and Genomics, or ACMG's, secondary findings list, a minimum list of genes with evidence of causing preventable or treatable disease. Figure 1 shows the breakdown of these genes. Cancer genes represent almost 40%. In May 2021, version 3 came out and 3 new cancer genes were added: PALB2, MAX, and TMEM127. Figure 2 shows the breakdown of cancer results returned by MyCode prior to the version 3 gene changes. The release of the updated secondary findings list prompted Geisinger to review their list of genes for return, so I evaluated the cancer genes. Because the ACMG secondary findings list is intended for a diagnostic setting, the goal of this project was to identify challenges that may arise when screening in a population setting. Genes were evaluated using data on gene disease validity, clinical actionability, and population-based prevalence and penetrance. Gene disease validity is the evidence strength of a gene causing a disease. Specifically, we are looking for definitive or strong validities because we want to ensure that there is a close link between a gene and a disease. Clinical actionability is the known ability to intervene and prevent a poor clinical outcome. We are looking for definitive or strong assertions, or an actionability score of a 10 out of 12 or higher if the assertion is pending. 10 was a score that separated genes on the ACMG list from other genes. If you turn your attention to the gene disease validity column of the table, you'll notice that most genes have definitive or strong classifications. However, 2 genes, APC and PALB2, have moderate classifications. PALB2 is a bit unique because it was curated for breast and ovarian cancer separately. Moving on to actionability, you'll see that most of the genes have a dash, which means the assertion is pending, but those with assertions met strong actionability. However, you'll notice that many of the genes have actionability scores under 10. In the next columns, you'll see the genes with limited population-based prevalence and penetrance. This is especially important because MyCode does population screening. In conclusion, with the addition of PALB2, MAX, and TMEM127, cancer results returned by MyCode will increase by approximately 17.8%. These curation results should be considered when reevaluating what genetic results should be returned to participants. Last, a lot of the shortcomings in the results are due to a lack of research, so additional research is needed to understand the implications of using this list in a population setting. Thank you.